Hey guys, so this is just a little update on how I've been. I've been doing pretty good, just getting really fat. I don't know, you could probably tell by my face. Everyone's telling me that, it's almost time. You look ready, and I'm like, yeah, I think I could tell. I look so chunky and, you know, so, I've been doing really well. At one point, I think like around 34 weeks, I had a little bit of an issue. I woke up and it was a Sunday and I went to the restroom, and when I wiped, I saw a lot of blood. So I had to go into the labor and delivery, and they were checking me and they monitored the baby and they wanted to see how everything was doing before they could let me go. So in the end, everything turned out pretty good. It was, they didn't really explain to me what happened, but they just said to be on bed rest. So I was on bed rest for, a few days, and that was basically it. Nothing like that ever happened again, but it was a scare because I didn't feel her move that morning, so I was a little bit afraid of what was going on, but everything was fine. So that was the major thing that happened to me. So yeah, that was just it. That was the only scary thing. Other than that, I had my baby shower. Every week my belly's been growing and growing and growing, and so have I. A lot of stretch marks and a lot of craziness going on with my tummy. But, it's all worth it, like I always say in my videos. It's all worth it in the end. So I got a couple questions. One was, where am I going to give birth, or, if I'm going to have a home birth or stuff like that. I plan on giving birth at a hospital, and, I just hope they treat me good and that everything goes well. I want to have a natural delivery, a vaginal delivery, but if by any chance, something was wrong with the baby and I had to have an emergency C-section, I would, I wouldn't hesitate on anything. As far as the epidural, I want to go as natural as possible, but if it gets to be too much and I really, really, really want it, then, I don't mind. But yeah, so that's that. I also got asked, if I'll be using, what are they called? Like disposable diapers, or the other ones, cloth diapers. There we go. I wanted to do cloth diapering, but the thing is that I don't have a washing machine or a dryer. I usually go to my mom's house to do my laundry and stuff, so that would just be too much of a hassle. So I'm just gonna do disposables and see how they go, and if something doesn't go right, or if I see that my baby has like some kind of reaction to them or whatever, I'll just try and see if I could somehow switch to the other kind. My bad, I keep forgetting what they're called. So that's that. Yeah, so the diapers, the hospital birth, and I also got asked about symptom, I guess, gas in particular. I know this sounds silly and everything, but it isn't. You shouldn't be ashamed to ask these type of questions because it's normal in pregnancy. I actually did have gas. I still do. It's normal. But it wasn't like to the point where it was really, really bad, or it would happen in front of people, or, something that embarrassed me out of nowhere. It just happens. But I hear it has a lot to do with like the food you eat and stuff like that. So I would just suggest, you know, eating, trying to cut out certain foods, dairy maybe, but like consult your doctor about it before, because, you know, that's something our bodies need to develop our babies. But yeah, I didn't really suffer too much from that symptom. It was just something normal and common in my pregnancy. Another one was my weight. So I have gained approximately like 23 pounds in total, and that is really good. The doctor really likes the fact that I've only gained that much, because like I said in previous videos, I was overweight before I got pregnant, and so that's a good thing. My weight hasn't been too crazy. And aside from that, my blood pressure, you know, all that stuff, it's been really, really good. It's actually been on the lower end, which the doctors prefer. And I tested negative for strep B, so everything's good there. And yeah, so just waiting now, you know. If you guys have any kind of questions, feel free to ask, because I'm more than willing to answer them. Yeah, so I'll let you guys go now, because I'm really tired and out of breath, if you could tell. But yeah, I'll be here to answer any of your guys' questions, and thank you so much for watching my videos, and I'll talk to you guys later. Bye! Just something I wanted to include really quick that I forgot to mention was I was asked if I was going to breastfeed, or, you know, and yes, I do plan on breastfeeding. I hope that everything goes well with that, you know, I'm able to produce milk and that my baby's fulfilled and everything. I just hope that that works out, because I really, really, really want to breastfeed. In case that weren't the case, then obviously, you know, I'd go with formula. But I'm gonna try my best, you know, to be able to breastfeed her and not give up. So, I just wanted to, you know, add that in there really quick. I forgot to mention it. So I'll talk to you guys later. If you have any questions, just let me know. Alright, bye!